大家好，我是来自首都医科大学的穆泓宇。俗话说得好，春困秋乏夏打盹，睡不醒的冬三月。对很多人来说，给他一张床，他能睡到世界灭亡。当然，这有一些夸张的成分，但他生动形象地为我们引入了今天的主咖——发作性睡病 （Narcolepsy）。今天我将利用 CK Student 上的资源，和大家一起学习这个疾病。首先，让我们先来看一个病例。
A 22-year-old man began having difficulty staying awake during college, even with 8 to 9 hours of sleep at night. He fell asleep during classes or when he was trying to study at home. He found that a 5 to 10 minute nap was moderately refreshing, at least for an hour or two. The patient had noticed that he would lean against a wall or sit when he was laughing, as he otherwise might suddenly drop to the floor as his legs unexpectedly collapsed, the symptoms of which are called cataplexy in medicine. On another occasion, he had a very frightening sleep paralysis, which means when he woke from a nap, he was unable to move. At that same time, he had a hallucination, a sense of an evil stranger peering over him. After 45 seconds, he got back to normal. Results of an all-night sleep test was normal, aside from a borderline REM latency of 51 minutes. A multiple sleep latency test containing 5 daytime naps showed a reduced average latency to sleep onset of 3.2 minutes, and 3 of the naps contained REM sleep. Thus, he was diagnosed with narcolepsy. But here comes the questions. What is narcolepsy? And what are the symptoms, diagnosis, and etiology of it? As doctors, how should we deal with the disease? So basically, narcolepsy is a primary sleep disorder wherein the central nervous system regulation of sleep, and particularly REM sleep, is impaired. Patients with narcolepsy tend to be much sleepier than the average person and have episodes of an overwhelming urge to sleep. On the basis of cataplexy, narcolepsy is categorized as 2 types. So the patient in the former case is obviously type 1 narcolepsy. According to the Ferris clinical advisor, there are 4 main symptoms in narcolepsy, which are excessive daytime sleepiness, cataplexy, sleep paralysis, which is a feeling of being conscious but unable to move between wakefulness and sleep, and hypnagogic or hypnopompic hallucinations, respectively meaning imagined sensation that seems very real when you are falling asleep or waking up. Meanwhile, 40% of patients have experienced automatic behavior or semi-purposeful movements, and 50% claimed of memory disturbance. So after the clinical presentation, how will doctors usually make diagnosis? It's often diagnosed by clinical history, but persistent sleepiness can occur with many conditions. So it's important to rule out insufficient sleep, drug uses, and other sleep disorders. And the Epworth Sleepiness Scale is very useful in determining the degree of excessive daytime sleepiness. However, clinical symptoms are not enough. Nocturnal polysomnography followed by a multiple sleep latency test remains the gold standard for the diagnosis of narcolepsy. With average sleep latency less than 8 minutes, more than 2 sleep onset REM periods detected, and REM latency less than 15 minutes, we can make the diagnosis. As for etiology, scientists are not fully aware of their cause, but the loss of hypocretin or orexin signaling, genetic factors, and brain lesions are presently identified to blame for the disease. Hypocretin, also known as orexin, is a neuropeptide hormone produced in the lateral hypothalamus that exerts important influences over sleep. Pre-orexin neuron knockout mice exhibit hypersomnia, and human cerebrospinal fluid levels of hypocretin-1 are undetectable in narcoleptics with cataplexy. It has also been reported in genetic syndromes, and HLA gene DQB1-0602 is present in most narcoleptics. Besides, central nervous system lesions, including tumors, vascular malformations, and strokes, have all been reported to cause secondary narcolepsy. Narcolepsy can be treated with a combination of behavioral and pharmacological approaches. For non-pharmacological therapy, optimal sleep hygiene, scheduled daily naps, and psychosocial support can be used for symptoms of excessive daytime sleep. Pharmacological treatment includes CNS stimulants, such as modafinil or amphetamines, for sleepiness. Ancillary symptoms are treated with selective serotonin reuptake inhibitors SSRI, such as fluoxetine, or serotonin norepinephrine reuptake inhibitors SNRI, including venlafaxine. Besides, traditional Chinese medicine and acupuncture are widely used to treat full narcolepsy and has achieved satisfactory effect after appropriate treatment.
发作性睡病在我国仍属罕见，一直以来社会关注度不高，诊断手段也不完善，常被误诊或漏诊，其临床表型及发病机制仍有很大的研究空间。如果您也有相关的嗜睡症状，一定要多加观察，必要时一定要前往医院进行就诊。以上就是今天 Pbl 的全部内容了。如果您觉得有所收获，还请点赞支持哟。最后，祝大家开怀笑，放心睡，愿世界的每个角落都有好梦。